Hello, I'm Bridget and this is Damon.
Oh,
How are you doing?
can't breathe.
So your patient appears to be quite cyanose as well, quite pale, a little bit diaphragmatic to the forehead.
Damon, could you get some monitoring on, please? We'll get a quick SATs first. Can I take your hand? Super, well done. You don't need to talk for now. If you don't want to, we're just going to get some monitoring on nice and quick.
Got a good radial pulse there as well. It feels a bit tacky.
Okay. And what are the SATs going back there?
Saturation's come back at 83%.
I'm just going to pop on a mask while we're talking. So what's happened tonight? What's happening?
Can't breathe.
Since when?
Oh, that worse than 2 days.
Okay. So I'm going to give you this mask to breathe through. Just pop it there on your face. I'm going to have a listen to your chest, okay?
So
How does chest sound?
inspiratory, expiratory wheeze, all fields.
And what's your medical history? Do you have breathing problems normally?
Oh, emphysema.
Mm-hmm.
Yeah. It's not normally this bad.
Okay. Well done. You're doing great.
Oh,
So Damo, if we can set up to give her some salbutamol and some ipratropium and a neb, we'll get that running. And would you mind passing? I'll do this if you want to pull out the drugs. Not such things. Have her SATs come up on oxygen?
Minimally, it's now 84.
So, do you take nebulizers normally?
just Papa.
Okay. And are you allergic to any of them?
No,
No.
Panadol.
Okay. No worries. So, you drug check that one for me, please.
Yep. Ipratropium and bromide, 200 micrograms in 1 ml.
Ventolin 5 milligrams. September 19.
Sure.
Super. Thanks very much. And
They're all
two-
in check. Yep.
two Ventolin. Okay. So I'm going to give you some nebs,
Okay.
and then after that, hopefully, you'll feel a little bit better,
Mm.
and we'll be able to have a chat.
Mm.
Okay? Would you set up for IV access,
Mhm.
please? Okay. We're going to switch this over.
The temperature was 38.4.
Okay. Sorry. So that net is running there now. And some monitor. Blood pressure.
Blood pressure comes back at 120 on 90,
Okay.
and that heart rate is tacky at 130
Yeah.
as you felt it with pulse, normal pulse.
Okay. Can you tell me any more about your medical history?
Oh,
Any other medical problems?
COPD.
Mm-hmm.
Heart problems.
Have you ever had a heart attack?
No. Just had some heart problems. I don't really know.
Okay. Do you are you normally able to get around the house and that without getting so puffed?
Yeah.
Have you been coughing up a lot of stuff?
Yeah.
What colour is it?
Oh, I don't know.
Is it clear or is it dark or green?
I don't look at it.
Okay, no worries.
Oh.
And you said you've been getting worse for 2 days. Have you
Yeah.
felt a fever? Have you been feverish?
A little bit. Yeah.
Just note that your patient's just still an increase in work-order breathing. She's only now able to speak in those single words.
Okay.
She's having a bit more difficulty in speaking.
Okay. After this, let's drop some hydrocortisone. We can give her some hydrocortisone. I'd also like to get a 12-day ECG just to make sure we are dealing with an exacerbation of her COPD. Anything else when I examine her chest, increased work of breathing?
Yeah, so she's still cyanoid, she's got accessory muscle use, the tripod positioning,
Mm-hmm.
and still quite diaphoretic to the forehead.
Does she have edema in her ankles or her
No.
lower back or anything like
No,
that?
how you see it, so not at all. She's quite a small framed elderly
Mhm.
female.
Okay. And her obs, tachycardic?
Tachycardic at 130, blood pressure remains at 120, 190, and febrile 38.4.
Yeah, okay. So I'm just going to organise some fluids. So I'm going to set up a fluid challenge where she's got, and you're doing the hydrocortisone, Damon?
Yep.
Excellent, thanks. So I'm going to run. Fluids to the cannula here as well. So we'll just start off with a 250 ml bolus and see how she goes. What happened when I listened to her chest? Is she still moving air?
She is, but very little here in Spiritual Ways, in all fields. Very little movement on expiration.
Okay. And the salbutamol, that's still running?
Yeah, it's still running.
Yeah.
It's got quite a lot left in it there.
I'll keep that going.
What is that?
Hydrocortisone, 100 milligrams, 1124 milligrams, 124. So we're giving her 200,
Yeah.
mixed into 10 mils, slow push over 2 minutes. Thanks very much. So can I get you to push that? Just slow over 2 minutes, please. So the history is emphysema. She appears to have an exacerbation of her COPD at the moment. So we're managing her with salbutamol and ipratropium. We've given the hydrocortisone, a little bit of fluids to deal with her her infection, her sepsis, or possible sepsis of root. So I'm trying to decide what the next line of management. She's not improving. I feel with her heart problems, I'm concerned about giving her adrenaline, even though it might help her bronchospasm, mucus production. Well, I won't talk about mucus production. Might help her bronchospasm. How are you feeling now? Continuing to deteriorate, Erin?
It's just single words. As I said before, she's just got that inspiration and pretty much very little noise on expiration. You can barely hear anything.
And exacerbation of COPD isn't usually an indication for CPAP, but she looks like somebody who could benefit from it. So I might consider giving the consult line a call, see if they'd consider her if we should consider her for CPAP. Anything else I can do at this stage?
The patient just says she knocks her salbutamol and just says it's not working.
Okay. I'm stuck about whether or not she's indicated for IV salbutamol. So
Seems like that air movement's getting a bit more minimal.
Okay.
She's now unable to speak.
Yeah. So I think we're going to go with some IV salbutamol and see if that improves, because the neb isn't working. She's not managing to move any air. So can I get you to draw up the salbutamol, please? We're going to give 250 mics IV salbutamol, 500 mics and 1 ml. So
Draw the whole lot up.
draw it all up, please, and then I'll give half of that syringe IV. We can give up to 4 doses of that IV, so at 5-minute intervals. So I'll get you to have a look at the time just as we give it, and we'll repeat that after 5 minutes. What are her sats reading now?
84%. She still maintains the cyanosis. She's still pale and diaphoretic. Pursing her lips now.
So salbutamol is in date, and it's 500 micrograms in 1 ml.
Okay, we're going to give 250 micrograms now.
And how much of a mil is that?
Half a mil, so it's half of the vial. And I'm going to keep the other half and give that a good flush through. And keep that other half for in 5 minutes' time. I'd like to get organised to get her moving to hospital. I think ultimately BiPAP would be more appropriate for her than CPAP. So can I get you to organise stretcher? And I'm going to try and encourage her to continue taking her neb. So just try and keep breathing in through that. How are you feeling now?
Same.
Okay. I'm going to repeat her obs again. Sats are still the same, no improvement since the
85%.
IV.
Yeah, so it's at 85%. You have noted that she seems like she's just able to get a word out, but still looks quite unwell from when you initially walked in the door. So very, very small improvement.
Yeah. Okay. Let's continue with the plan. So of getting her to hospital when we can. I'm going to pre-alert the hospital that we're coming in with her. And I'm just thinking through my protocol to see is there anything else I can do at this stage to help her. Can I get you to drop some IM adrenaline in a 1 ml syringe, so drawing up 300.3 of a ml of adrenaline in an IM syringe. We're just going to hold off on that for now. Anything under 12 lead? Any other concerns?
Yep, so you've done a 12 lead and it just appears to be a sinus tachycardia. She's got some minor ST depression only in her anterior lateral leads. So heart's going to
That's rate related ST depression. Yeah. And I'm wondering about giving her magnesium to deal with her bronchospasm. I'm just thinking that through. We could give her magnesium with but it's so I'll hold on to that, but I just won't give it to her just yet. Thanks very much. But that would be another possibility we need to consult for, and it's not really proven to be effective in a COPD patient. So for now, we're going to keep the salbutamol going. I'm going to give, we're almost at time to give the second dose of IV salbutamol and get moving to hospital. Thanks. If you do another blood pressure for me. So the monitor's just changed to this slave. No, sorry. Okay. So can I see her medications, or can you tell me what her medications are?
So she pulls out her medications, and in a box she has some aspirin, Symbicort, Ventolin, Prednisolone, and that's all.
Can you say them again for me, please?
Sorry, an aspirin,
Yep.
Symbicort,
Yep.
Ventolin, and Prednisolone.
Super. Good. How long have you been on the steroids for? Do you take them all the time?
I don't know.
Did you take this tablet all the time, or is it just recently?
Recently.
Okay. So she's just started on that, so I presume this is an exacerbation she's been suffering with. And she's not able to take Panadol for the fever. So I'm going to give that second dose of IV salbutamol now. That's the second 250 mic bolus, 250 mic IV, and the fluids are still running. How much fluid has gone in?
Say 300 currently.
Okay. Any signs of fluid overload or
No.
adding
Well,
crackles?
when you listen to the chest, you hear what you heard when you first walked in, so it seems like some improvement. She's now got an expiratory wheeze again.
Okay.
But it just sounds a little bit more movement than when you even first walked in the door.
So a slight improvement. I'm going to give a second salbutamol now as soon as that one's run out.
Yeah, I'd say that one's
So
run out
15
now.
minutes in.
Yeah.
Yeah. So
And you do notice an improvement, where you start saying, yeah, I'm feeling a little bit better.
okay.
It's still bad, but a bit better.
Okay. So is her respiration improved a little bit?
Rest rate's still high,
Yeah.
but it's not at the rate of 36 it was initially.
Yeah.
It's currently at about 28.
Okay. And still
Saturations have come up to 89%.
okay. And her
And her workload of breathing seems decreased. She doesn't have the accessory muscle use that she had before.
okay.
She appears a bit more relaxed in her sleep.
Super. And her blood pressure is Around the
Currently 105. Yes.
so I'm going to continue with the salbutamol now. Just run that continuously. And start getting to hospital. We get her moving.
Stretcher's just there.
We get it right over beside her so that she doesn't have to she doesn't have to stand and turn very far. I don't think really can get her off.
We could do need be.
We could just say that you've repositioned the patient on the stretcher.
Okay, so you're onto the stretcher. Going to pre-alert the hospital. Just let them know that we're coming in with her lady in her 70s with COPD and an acute exacerbation that has over the past 2 days and tonight increased work with breathing, SATs in the 80s.
Did you want to do the phone call? Did you want me to be in hospital?
Yeah, sure.
Sure.
Yep.
Okay, so ring, so Redlands ED.
Oh dear. Hi, Redlands, Bridget here, critical care paramedic with QS. We're on our way into with a patient, if that's in order. 76-year-old female, she's a history of COPD. She's been feeling an exacerbation of her symptoms for the last 2 days. Acutely worse tonight. When we arrived, she was tachycardic with SATs in the 80s. Severe difficulty breathing. She's had continuous salbutamol nebs and samidorphan nebs. She's had 500 micrograms of IV salbutamol, and she has had 200 milligrams of hydrocortisone IV. At the moment, she's showing some improvement, moving a little bit more air. Her SATs have increased, and she's a little bit more comfortable. I believe she'll need a resource bay, and we'll be with you in about 10 minutes.
Okay, we'll see you then.
Great. Okay, thanks.
Which code would you like to go to hospital?
I'd like to go on a gentle code 1 at the moment. It's the middle of the night, so hopefully there won't be any traffic issues. But we'll just go nice and gently. I feel she's going to need ongoing management for the night in recess, so I'd like to get going there.
And what are some of your other your management en route?
I'm going to continue with the IV salbutamol.
Mm-hmm.
I think 250 ml bolus hasn't had any detrimental effect, so I'm going to continue with the second 250 ml en route. We're going to continue monitoring her. She'll stay on the nebs. If she isn't continuing to improve at the rate she has over the last 5 minutes, I'm going to give another dose of IV salbutamol after 5 minutes.
Do you have a max dose in that?
4 doses, so that's 250, so that's 1,000 micrograms in total. And we've given 2 already, so we've 2 to give if necessary. Reassurance and coaching her breathing.
I think that's the end of the scenario. Well done.
Thanks very much. Thanks very much. You look like you were struggling there for a while.